At this Toronto pharmacy, here's the fridge where the COVID-19 vaccines used to be.
The Public Health Agency of Canada has issued a market withdrawal.
When pharmacist Fadi Salama got this memo last week telling him to destroy his existing vaccine supply, he wondered if it might be a scam.
It was confusing enough for me to not take it seriously at first, and then I kind of read through it a little bit more and it seemed legitimate.
It was indeed legitimate from Ontario's Chief Medical Officer of Health. But with no new supply of COVID vaccine expected for weeks, it's left Salama puzzled.
Why would we get rid of something that is still good?
Ontario blames Health Canada. The federal agency wants the existing vaccine supply withdrawn before it will distribute an updated version targeting the newest strains of COVID.
I don't think that at the national or at the provincial levels, they're trying to create a vacuum. I think this is a harbinger that the updated formulation is going to come soon.
Health Canada says provinces are allowed to use last year's vaccines until the transition to the new shots, but there's clearly confusion. Alberta and Saskatchewan have joined Ontario in scrapping their existing stocks. British Columbia is keeping its supply available. Marie-André Lajoie plans to travel overseas next month. The appointment she'd booked for a COVID shot has now been cancelled.
I like to be vaccinated. I believe in that stuff. They want us to be vaccinated, and all of a sudden, poof, no more vaccines.
Lajoie will now go get her shot in the U.S. Regulators there have already approved updated versions of 3 COVID vaccines. Here in Canada, they're all still under review. Officials expect they'll become available to Canadians in late September or early October. Mike Crawley, CBC News, Toronto.